The emphasis on caution and ethical considerations when approaching population control models is underscored, as coercive measures infringe on individual rights. Instead, the focus should be on models that empower individuals for voluntary, informed family planning. Several innovative mathematical models are proposed. Agent-based model with social learning simulates individual families' reproductive decisions based on socioeconomic factors and social interactions. Incorporates social learning, allowing individuals to adopt family planning practices observed in peer groups. Models interventions such as educational programs, economic incentives, and improved access to contraceptives. Game theory model of family planning dynamics represents couples as strategic players making decisions to maximize well-being. Includes factors like child costs, career aspirations, and government policies. Analyzes equilibrium outcomes to identify interventions incentivizing smaller families without coercion. Machine learning model for predicting contraceptive needs. Trains on demographic data to predict individual contraceptive needs. Targets outreach and resource allocation for family planning services to improve efficiency and accessibility. Potentially influences birth rates indirectly. Network analysis of information diffusion models the spread of information about family planning through social networks, identifies key influencers and communities for targeted interventions and awareness campaigns, overcomes misinformation and promotes positive messages about responsible parenthood. Additionally, a comprehensive conceptual framework for a population control mathematical model is outlined, considering variables like birth rate, death rate, migration rate, resource availability, economic development, education index, healthcare accessibility, and contraceptive use. Assumptions include a closed population, resource availability affecting birth rate, economic development influencing family planning, and education and healthcare impacting birth and death rates. Mathematical equations represent net population change, birth rate, death rate, resource availability, economic development, education index, healthcare accessibility, and contraceptive use. Model dynamics incorporate the influence of economic development, education, healthcare, and resource scarcity on birth rates, death rates, contraceptive use, and population change. Policy implications include implementing education and awareness programs, improving healthcare infrastructure and accessibility, promoting economic development, ensuring resource sustainability, and facilitating family planning services. This dynamic and interconnected model offers adaptability to specific regions, aiming to simulate the impact of interventions on population dynamics, considering the multifaceted nature of population